So for those of you who chose mostly C's, you are making this decision with a clear mind, confidence, and compassion. This is wonderful. This means you're not letting your emotions get in the way. You don't have a problem with the idea of euthanasia. You think it's a great thing to do, a loving, kind thing to do. But where you could get into trouble is with a lack of information. Don't take this personally. Veterinarians don't always even have this information. And that's the ability to really understand if your pet is doing well or just deceiving you with their great attitude and ability to cope. How do you know what to do? I did create a full course online that you can take. It's really easy to watch. It's divided into 5 videos, and it's really designed just for someone like you that just really wants to get all the information on how to assess quality of life, how to read those subtle changes in your pet's behavior, and how to know what pain looks like in pets, because pain does not look like crying at all. It looks like a dog that's excited to get a Frisbee but still limping. That's pain, and it confuses us because your dog may still look excited. It looks like a cat who's really snuggly and purring. How would you know that's pain? It can be very confusing. So it's really important for you to get all the information because you're just in the right mindset to make the best decision for your pet. You just need all the information. So I really encourage you to watch the course that I created online. The other thing is trust your gut. You may be looking for more of a logical answer because that's where you're at. And honestly, the answer may be a little ethereal. It may be a little more intuitive. Like you can't put your finger on it, but you just know your pet isn't doing well. Trust that. I really want those of you in this group to trust your instinct. If you're like, I don't know what my pet's been diagnosed with. You know, maybe all the tests have been inconclusive, which has happened. Maybe my pet already has been diagnosed with a disease that's not going to end well, like cancer or kidney failure. Maybe your pet's just slowly declining. Oftentimes people talk about their pet losing hearing and eyesight. That's just the beginning. They're also maybe losing, interest in eating, interest in doing things, but maybe they just don't seem like themselves. Maybe it's not one thing you can put your finger on and you're like, my pet just isn't acting like himself or herself. What I would tell you is trust that instinct and don't doubt yourself. And if you need help, you have the course. You can always schedule a consult. You can talk with your veterinarian and schedule a quality of life consult. Just be really clear because veterinarians are looking for your guidance to have this conversation. I'll let you in on that. A veterinarian is not going to be bringing this decision up because they often are worried that it could be offensive that they're even thinking about euthanizing your pet. So it's really important for you to just be clear, and don't worry, we're not judging you if you're thinking about euthanizing your pet and you're just asking for help and guidance on how to do that and when to do that.